New research shows taking melatonin for long periods of time could be a sign of underlying heart issues. Data released by the American Heart Association found that long-term use of the popular sleep aid is actually linked to a higher risk of heart failure and early death in adults with insomnia.
You consider making an appointment. This was a big study, more than 130,000 people in it. People who took melatonin for more than a year consistently were twice as likely to develop heart failure and more than 3 times as likely to be hospitalized for the condition compared with people who did not take melatonin. 19% of people who were in the melatonin group had to be hospitalized with heart failure compared.
You might be hearing this and you might be alarmed because you might be someone who's using melatonin at night. I know sometimes I use it myself. Here we have an article about melatonin and heart failure as a promising therapeutic strategy. On the side, I have the documented summarized by Boardmaster. Now, pro-BNP levels are something that we commonly use in the clinical setting to see whether or not someone may or may not have heart failure. And here in the study, it states that patients with acute or chronic heart failure often have reduced melatonin levels. Serum melatonin inversely correlates with NT-proBNP levels, a marker for heart failure severity, and predicts left ventricular remodeling post-myocardial infarction. So based off the study, we're able to see that patients with heart failure already have a low level of melatonin to begin with anyway. And we know patients who have heart failure also have an increased risk of obstructive sleep apnea. And obstructive sleep apnea can also lead to cardiac remodeling, which can further increase the risk of heart failure. And so it makes sense that patients who have obstructive sleep apnea also take melatonin to help them sleep. So we need to consider a multitude of factors before we state that whether or not melatonin does in fact lead to heart failure, as information like this can be very misleading. By the way, if you're a medical student, then you need to try out Boardmaster. It's completely free and has been life-changing for many medical students. Here on this medical document about melatonin, all I have to do is highlight anything that I'm not familiar with, click explain. Instantly, I have information that's generated about this document, so I know more about it. This has been Dr. Albazor. Thank you for watching, and I'll see you in the next video.